Moving on to some sports, we've had a 21-year-old gym trainer who had a rugby injury. He's had an abduction external rotation where his arm was yanked by a colleague, by another player. Since then he's had recurrent instability, and if you could look at the MRI, on your left is the ball, and the glenoid is a T, so it's like a golf ball on a T, and it's made more deeper with the anterior labrum and the middle glenohumeral ligament. And if that comes off, it remains unstable all the time. The management could be operative or non-operative, but generally young, fit, healthy individuals end up requiring surgical fixation of the torn labrum, and now pretty standard that we do this through an arthroscope or arthroscopically. So just going through this very quickly, this is a view from the back looking at the muscle in the front. This is the subscapularis with the middle glenohumeral ligament, and you can see the tear going through. That's the long head of bicep, and that is the rotator cuff muscle. And you can see this big rent going through not just the labrum, but it's actually gone over where the long head of biceps attaches to the shoulder. So it's quite unstable, and we're trying to reflect and see the whole thing is actually falling onto his glenoid, and no wonder he remains unstable. It's not just that the joint moves out of place, his long head of biceps slips down and causes irritation as well, limiting activities of daily living as well as his profession as a gym trainer. Quickly speed down to show what happens. This is where I'm shaving and refashioning the edge of the glenoid in the front, where this glenoid is, the intention is to repair it back into place. Once the clear out is done, I've also cleared out the base from where the bicep is going to attach to the superior glenoid. Next, what happens is we pass a suture. This is an ultra strong suture through the labrum, and we anchor it into actually the glenoid surface itself with a drill. These strong sutures are looped and passed through a special anchor. I prefer to use, there is no need to take them out, and also more importantly become less of a focus of infection. Here we're using what we call a suture lasso to get to tricky parts of the shoulder joint or other joints for that matter. This loop will be taken out from another portal, and sutures are passed through these, and it will go around the bicep itself and knocked back into place in a sense. So that's where the suture goes through from the other side of the anchor, and we bring the suture back into its place. This is then cleared, and the anchor is put in a similar fashion as was for a labrum repair, which is then drilled through, and a looped anchor is passed through in. All done through tiny holes the size of the tip of your finger, about 4 to 5 of them. Following this, the patient is seen in 2 weeks' time in clinic, and a rehabilitation protocol which is printed and given to the physiotherapy team to work on.